We're on to the next section, practicing expert thinking. Now, there's different aspects of expert thinking, but let's look at the diseases you will see frequently. Especially you clinical officers. You will see a lot of infectious diseases and you will see a lot of chronic diseases. The problem with seeing all these problems is that you see so much of this, and the surgical and obstetrical problems that are hidden among them can get missed. You start to think everything is an infectious disease, and you get bored, and you don't use your mind. So you need to classify your infectious diseases and your chronic diseases. So this is a grid that you can use every time. So what's a low-risk infection? You are going to see a lot of malaria. And it's important to treat it. But you'll think, another malaria. You're going to see a lot of worms. And it's important to treat it. But everything isn't low risk. Other things happen. You can have chronic malaria. You've treated them for malaria, they're not getting better. You can have diarrhea. You have a child, comes in with diarrhea. You put him on clear fluids. The mother does what the instructions are. She comes back, the child still has diarrhea. This patient is not getting better. This patient should be referred. There are high-risk infectious diseases. Cholera, profuse diarrhea. Resuscitate that patient, give them intravenous fluids, but they need expert treatment. Meningitis. If not treated well and rapidly, you can end up with death, or even you can end up with mental disability due to the meningitis. So you need to classify your infectious diseases as low, medium, and high, and treat all those low-risk patients. When they're not getting better, refer them. When they're serious, resuscitate them and transfer them. What about chronic disease? Let's use high blood pressure as an example. You can have a patient with blood pressure that's a bit elevated. You treat them with a diuretic, for example, and they get better. Then you carry on treating them. But what happens when you've treated them and they're not getting better? They're still there. Then you need to send them to somebody who can give better understanding of the problem and control them. Uncontrolled blood pressure on a long-term basis leads to stroke, leads to paralysis. It's a big problem in Africa. You need to refer it and get expert opinion on that, and then they come back. There is also people with hypertension, high blood pressure, that's so high, you don't wait and refer them. You send them on their way now. So you, as clinical officers and even as midwives, will be seeing a lot of infectious diseases and chronic diseases. You need to classify them as low, medium, high, and treat them appropriately. Low risk, you take care of them. Medium risk, you see if you can get them better, but if not, send them on their way. High risk, resuscitate them and send them urgently. So this is how you have expert decision making concerning infectious and chronic diseases. This grid is also useful for surgery and obstetrics, and we'll go on to that in one moment.